I hate the eye. I don't like learning about the eye. I hated every second of it. That's probably because I didn't know how to study for it. I'm going to make it easy for you guys. The muscles of the eye, knowing what they're innervated by, it's super important. It throws you off guard, but it's super easy to remember. Let's go over what the muscles are. We have the lateral rectus, which is in charge of outward movement. We have the medial rectus, which is in charge of inward movement. We have the superior rectus, up, inferior rectus, down. We then have the superior oblique, which is down and out. And then we have the inferior oblique, which is up and out. So, yes, unlike its name suggesting, inferior and superior, their roles are actually reversed. So, inferior is actually up and out, superior, as the name does not suggest, unfortunately, it's in and out. So there's that. Now, in order for you to know which cranial nerve supplies which muscles, it's important to know what I like to call this the chemical formula for the eye. It's LR6 SO4 R3. What does that stand for? LR stands for lateral rectus, controlled by cranial nerve 6. So this is cranial nerve 6. That would be the abducens nerve. SO4 is not sulfate, it's superior oblique cranial nerve 4, so that's going to be the trochlear nerve. And R3 means that the rest are controlled by 3. So everything else is controlled by the cranial nerve 3. So how does this present? If we have a patient who is coming into the office and you see that his eye is constantly medial instead of its normal position at rest, then this means that the lateral rectus is not functioning and it's incapable of pulling this eye into the middle area. So in this case, the question would ask you, which area of the brainstem would you find the lesion? And that's when you have to go over your rules of 4, which we went over in our neuroanatomy videos. Go back and watch them, where we said that cranial nerves 3, 4, 6, and 12 are medial, 5, 7, 8, 9, 10, 11 are lateral. We know that midbrain is here, the pons are here, and the medulla is here. So if we said that the lateral rectus is dysfunctional, then LR6 means lateral rectus is controlled by cranial nerve 6. So if there's going to be a stroke or ischemia, it's going to present in the pons, and that is how you know. Or the question could be reversed, and they could say there's an infarction in the pons, which muscle would be affected, and that's when you know it's going to be lateral rectus muscle. And that's that. That's the